the elephant from get sick. And we also have a lot of connection, especially for the vet nurse, because there are many real case training going on in the northern part of Thailand. And our members are composed of elephant camp operator, and a common problem that we face is misconception about Thai elephant. Thus, we use the social media as a way to communicate to the general public about the traditional upkeeping of elephant and fun fact about them. We also hold the seminar for travel guide so that the right information are given at least once a year. This is all the social media that we use. In March 2020, Thailand has chosen to close its border to prevent spread of coronavirus. This also shut down the international tourism. So this is a picture of before the COVID crisis. You can see many foreigner tourists from all over the world visit Thai elephant and do many kind of activity with them, including some of the adventure activity nearby, like the bamboo rafting. And this is now, we have to stop all the tourism. And in some province, in the first few months, in some province has been locked down too. This is some part that I discussed with Dr. Pakanut or Dr. Im about what is the effect of COVID crisis to elephant camp and elephant. So the above of the part will be show the effect from no income for camps or mahout or even the stakeholder of elephant tourism. But the one that we very concerned about is the effect on elephant. Like the elephant without the income of the camp, they will lower the budget for food. So less of food, the elephant become weaker and weaker. And less of exercise, they may have the problem about lameness, gastrointestinal problem, foot and nail problem, and less of interaction between the herd and between elephant and mahout. Elephant and mahout can be very stressful for them, and in the long term, they will lower their immunity. And the worst thing is they might be not have the budget for sick elephant, like they can hire the vet, cannot hire vet nurse or even buy the medication. And the worst part is in case of the sickness elephant or emergency case, they cannot pay for the transportation for elephant to get to hospital in time. And for the rental elephant, the owner have to bring elephant back home. So during the summertime, is very the bad condition for the natural food because there are the drought situation and they also have the forest fire during that time. So not enough for food and they have to bring elephant back home, which mostly in mountain, so very, very far away from vet and hospital, and the route are almost difficult to access, and also no telephone signal in case of emergency. They cannot call us, and not enough of space for the mass elephant. To help the elephant, TEAA start to fundraising project called Walking Through COVID-19 with Elephants. So we use the hashtag to be keep up on our mission as hashtag ช่วยช้างถึงช้าง it means like all the budget go to elephant, and we use the hashtag from hands to trunk too. So phase of our project, we separate into phases. The first phase is we focus on food and elephant care due to the record of the driest drought in 40 years of Thailand. The elephant camp operator faced with the problem of sourcing food due to forest fire in addition to the lack of income. Elephant food become number one priority, and we start to look for food while making sure the health were looked after too. And phase two, once the rainy season arrives, food will become plentiful. We close phase one and focus on elephant health only. So in the picture is the forest fire in the northern part of Thailand, in Chiang Mai, and that burn all the natural food in the forest. So the forest during the March and April of Chiang Mai will become like this. We first approached elephant camp operator and asked what kind of help that they would need. We found that it mostly on food, and we learned that in each region of Thailand, the elephant ate different food. So this is our alliance. Normally we focus on northern and some province in southern part of Thailand. So we cooperate with Chiang Mai University or CMU, Thai Elephant Conservation Center or TECC, Southern Thailand Elephant Foundation or STEP, and Tourism Authority of Thailand or TAT. But for the big project like this, we have to collaborate more both on private sector and government. So this is all our alliance for doing the project. From day one to today is 233 days of our project. So right now we have helped 1,699 elephants all over our country, and mainly most of the elephant that we help is live mainly on the northern part of Thailand. So for phase one, this is how the forest look like on May 2020. So some of problems that we faced were mostly how to help the Hill tribe people. They were afraid of COVID-19, then they put up bar to prevent outsiders from going into their village. And some of the Mahout knew about this situation, so they decided to take elephant back home with them. However, when the elephant became sick, we couldn't get to them. And in Mae Wang area or the one district in Chiang Mai, many elephant camp operators had closed down, and many elephants was stranded with nowhere to go. So some didn't have the budget to pay for food or to transport food to elephant. With our phase one, we were able to source the food and fund to the transportation. So these are the food support. We support in the northern part, northeastern, central, western, eastern, and southern. So for the northern part, we do it by our organization, but from the other, we have to cooperate more. Like northeastern part of Thailand, we collaborate with Thong Thai Elephant Transportation Team. They can transport both the elephant and the elephant food. And for central, eastern, and western, we ask for more help from wildlife unit from Kasetsart University. And for southern, the big role will be on STEP staff and Shanghai group. For the main fruit like grass, pineapple stalk, and corn stalk, we send to deliver the food for every camp that asking for help. These two pictures is from Phuket province. The camps asked for the budget to buy pineapple ranch so that they can share together, like with many camps. And the mahout are willing to collect by themselves and to deliver the food by their own truck. This is the Southern Thailand Elephant Foundation of State. They carry on our project on the 4 provinces in Southern. They took care of Phang Nga, Surat Thani, Krabi, and Nakhon Si Thammarat. So this is the difficult thing. Another difficult thing to send all the food to the Iceland is we have to get all the truck on the ferry and then go to the Iceland. This is the picture from Samui Islands and Phangan Iceland. So many of the elephant, almost 100, get stuck on the Iceland. And during that time in the 4 provinces that we mentioned, they are locked down situation. So in some area of elephant, they cannot transport the elephant food. And at the end of the phase, before we end up phase 1 for the main food, we gave the napier sapling for the north and northeastern village because some of the elephant home, they never plan about taking elephant back home for the long period. So they never have a place or the ranch for their elephant food. So we have to give the sapling and ask them to rental some land or some ranch to plant it later. So that will be the food for the next 3 or 4 months. Lucky for us that even we can't export the agriculture product, especially for fruit, but we lucky that the fruit farmer willing to donate all the fruit that they can export or they can sell anymore to elephant. And most of the social media take a very good part on this because most of the farmer, they do use the Facebook, and when they live or posting about asking for help, so many donors try to call us that they can help on buying the fruit, but ask us to provide to the elephant or deliver to elephant in each region of Thailand. So this is some part that we use this kind of truck to deliver the fruit. The first fruit, and it's very good to be the supplement fruit for elephant in every age, is banana. So we send all banana up on mountain, go to southern part of Thailand, and also go to the some part of Iceland. And in this year, watermelon is like very main food that donor want to ask, need us to be delivered to the elephant. The difficult thing about to transport the watermelon from farm to the elephant camp is curfew. In that period of time, we are under the curfew, so we have to finish all the work at 10 p.m. of every day. So we have to hire some of the truck to drive from central part of Thailand, Sukhothai province, to take the watermelon to each part of Thailand. For the northern part of Thailand, we have to ask many people and volunteer to help us to get the watermelon out of the truck. Because if we left the watermelon on truck like overnight, it will become in the bad condition and we shouldn't get the watermelon to the elephant. So this is how we loaded or the watermelon from the big truck in the small vehicle like this, and in the next day we take to the elephant. So this is how we take the watermelon out from the truck. And the mango is also another kind of fruit that be very, very nice for elephant, but normally we will not give to elephant because mango is like the seasonal fruit and very expensive price. So this is the mango that different kind of mango which exclusive for export. So even Thai people, we never eat some of their breed, but this year elephant can eat it all. So the first community that contact to us is the Mango Ranch community in Lamphun province, with very close to Chiang Mai. And then Thai Beverage Public Company Limited, or Thai Bev, consult with us about how that they can help both farmer and elephant. So we offer them all our connection all over the country about how that we contact to elephant camps, and we manage to do the deliver. So at the end of the project, we deliver about 30 tons or 30,000 kilograms of mangoes in 3 parts of Thailand. And another kind of fruit, like jackfruit. Normally, elephant can eat jackfruit, but the big size like this, mostly they just only for export. So this is the first time too that the big size of jackfruit can be given to the elephant as a food. So we collaborate with the Kasetsat University to deliver this kind of jackfruit because the ranch is in central part of Thailand. And another supplement food for elephant is sea salt, tamarind, and pellet food. So for the sea salt, we get like 20 tons from Malut company in Samut Prakan, and we also donate. We also get the pellet food from CP company and the tamarind from Internon community and the Opchang group. Opchang is mean like hugging the elephant. So they also donate and ask us on buying the tamarind for elephant. So tamarind we'll use like this when we want to give the medication for elephant. We will put all the pills inside the tamarind balls and cover with the salt so that it will cover the smell, the strong smell of pills, and tasty for elephant. So our first phase over about June and July. So this is the another season for our country. So you can see that more of the natural food for elephant in the forest and nearby the village. So since July 2020, we begin our phase 2 project. So in phase 2, we have to work more on field and travel a lot. So this is some part of picture that our vet team, including you can see Dr. Nisa, she also visit some of the camp with us in the northern part and eastern part of Thailand. And we also collaborate with some of the small animal clinic so that they can be like our vet volunteer in each region. And we have to collect all the data. So from our structure of our association, we do have many vets. We do have a group of vet nurses that very specialized on elephant, and we have 3 of the mobile clinic and medical box, and we do have 4 car of transportation to take elephant to hospital. For the healthcare project, we can separate for 6 projects. So first is mobile car. For the elephant mobile clinic, we collaborate with CMU and TECC too. So the challenge of phase 2 was how to bring veterinary team to the elephant. Most of the road on the mountain and small village can be difficult, and we try to mobilize as soon as possible. In the picture, you can see is during the summer. So when the rainy season coming, or the dirt road will become very, very difficult to drive. And not only me that have to take the motorbike, so every vet of our association have to go to the elephant as soon as possible. So we take all the vehicle that we can. So this is the route in the mountain. And even take the bamboo rafting. So in this case, we have to check on the elephant, which loose off the chain, and the owner not sure about is that 2 elephant eat some of the fertilizer or the chemical or not. So the best way to get to elephant is to take the bamboo rafting, so that we can take all the medication box with us. Because if we don't take this bamboo rafting, we have to do the trekking about 2 hours in the forest, and we cannot take too much of the medical box with us. So it's also the rainy season, so the water level is very high, and we have to go. So many times that when we arrive to the elephant, but it's not suitable place to do the treatment. Like this one, they tether the elephant near the rice field. So there are no stable, treatment pole for us to tether the elephant to stand still for us during we are doing our work, and there are no water hose for us to do the cleaning or to do the wound dressing properly. And most of the elephant tether with long chain in forest, so we have to ask the elephant mahout to take them out of the forest, because even I walk into the forest, but I cannot do the treatment there, because there are lack of the water and lack of the place to do. Without the good stable, our vets have to be very, very carefully on approach to elephant during the examination and the treatment. And many cases that we have to walk to elephant, so we cannot carry much of the medical or the equipment with us. So all the treatment would be like the first aid for elephant. And many times that we don't have the good place, and this place is the agriculture waste station that normally used in the village to do the waste station for the crop. But we have to ask the owner that can we bring elephant to do the treatment here, like for a few nights, and this is how it looked like. And this is another main problem that we found in the elephant is the GI problem or gastrointestinal problem, such as the colic or bloating and constipation. The constipation happens occur because the less of water drinking, because some of the elephant they tie up in the deep forest, and maybe just 1 or 2 times that they take elephant out of the forest to drink water at the river or the small stream nearby. So we found more and more of constipation case and diarrhea case in case of the elephant eat some of the dirt or soil, like to be the supplement for their self. And the wound and trauma also is another common health problem that we found during the COVID crisis. Because of sometimes when elephants go back home, they live together, they maybe live near, and sometimes they might be fighting for food and fighting like they can have enough of their own space. Sometimes they're fighting. And the abscess of the elephant, like this one. And some of them are weakness, like maybe lower of food for a long period, and they become weaker and weaker. So some of them may have a basal problem from lay down too long. And this is another problem because we found about 4 or 5 cases during this crisis that elephant ingest some of the fertilizer or the chemical agent that we use in the agriculture or the cornfield. So the elephant, when they bring elephant back home, they have to live near the village or near the agriculture area, so they can lose from the chain or get nearby or get into the ranch and then found some of fertilizer or chemical. And as you know that nowadays some of chemical agent had no strong smell and had no taste. So the elephant behavior, they're curious for everything. So sometimes they try, so they smell, and some of them may eat the fertilizer and the chemical agent. Like in this case, this is a big bull that lives like 3 hours away on the mountain. So as soon as our team get there and we monitor and we first aid for him, we discussed that we have to refer him to the hospital as soon as possible. So our truck cannot get into the forest, so we have to let him walk out of the forest. So it takes like another 5 hours for him to walk to the main street and then get on the truck. So even we try to send him to the hospital in 24 hours, we find the antidote for him, but finally he cannot survive. In this case, he eat the lead. It's a lead poisoning. The lead poison can be spread out all over the body in 48 hours, not like in people. So we have to buy the same medication that humans use for him. And this is the dystocia or difficult to birthing. So the dystocia, there are many cases since last 5 years because when the activity of elephant changed to be just keep up on eating the food from the tourists, less of walking, less of exercise. So most of the mother that pregnant can be overweight, and the baby can be too big to deliver through the pelvic canal. So the dystocia in elephant are very dangerous because most of the case we have to lose the baby, and in some case we lose both baby and mom. So during the crisis, we also found some of the dystocia, because when they go back home, less of activity, tether with the chain longer than they used to live in the camp. Because when they live in the camp, they have the routine activity, they have to walk every day and have to, and we can control the food. So right now, this is another problem, that even you bring elephant back home, you still have to have the routine activity for them. And second project is the transport elephant to hospital. The two main hospital that we refer our case to is TECC and Friend of the Asian Elephant, or FAE hospital. So this is all the 4 truck of our alliance that willing to do the work in the emergency case. From Matang Elephant Park and Clinic, and the car named Elephant Field Service, or EFA, from Thittaya Elephant Conservation. Mr. Vimon Sukson car and Metaman Elephant Camp car. So this is 4 car for the northern part of transport, our case. And for the other part, we also have the Thong Thai transportation team to take care. For the third project, medical box. For elephant medical box, we collaborate with CMU, TECC, and Asian Elephant Support. This is how it looked like. So we arrange all the basics on the wound dressing drug, and also some of equipment, and some of the saline to clean the wound, some of the eye lotion, because eye problems are very common in elephant, and some of the ointments like the massage ointments. And we sent all the vets to explain about how to use all the medication inside this box, and also give the number of the vet of TECC, of CMU, and our alliance, our association. And this is how we carry all the boxes to spread all region part of Thailand. And the fourth project is antiviral drug for EHV case. As we know that this viral is very dangerous, especially for the under 10 years old of elephant baby. So when they bring elephant home, the elephant baby have to change many of environment, like from the camp, maybe they live on the northern part of Thailand, but they have to go back home in Surin, which is northeastern part of Thailand. So the environment is different, have to change the activity, the routine activity. Some of them may change mood. So a lot of stress going on during that transportation and during the 3 months. Also, the weather is quite very changed for this year. So the EHV case can be occur in many provinces in Thailand. So we send all the antiviral drug. This is antiviral drug that we can buy it in Thailand. So many cases that report to vets, but when vets approach to the elephant baby, may be too late. So we send this drug to be in the village, or to be in the nearby the elephant village, so they can consult with the doctor by phone call. If the doctor said that or the clinical sign likely to be EHV, so they can have drug very near them, so that they can give this drug before take the elephant to hospital. Because we found many cases that we decided to bring elephant to hospital, but the baby cannot survive. So this is how we have to do our blood drawing to check to confirm the viral disease. And this is how we ask the elephant mahout to open their mouth. Don't forget to teach your own elephant baby to open mouth and to check, to do the health check basis for us. So it brings to the social media for educate the elephant owner and mahout how to take care of elephant when they are at home. Like we said that we are very concerned about EHV. So this is a poster, like very big one that we send to all the country to check the normal of fecal. And this is the fecal that have to concern about EHV infection, like the face and the face swelling. And this is the part that we ask the mahout, don't to forget to teach your own elephant, like to open their mouth so that we can check the color of the mucous membrane and also the pinpoint hemolymph like this. And we have the vet explain about this disease and how to prevent and how to get contact to the vet team. This is another poster. Since the big bull case, we get a phone call with many cases which similar to ingest the chemical or the fertilizer. So we do the poster to the farmer and to the elephant mahout. Don't forget to check all the chain equipment and ask for farmer to build like the room or clean all the chemical things out of the ranch. And also we ask the elephant owner, don't forget to check on the microchip number and do the transport permission from the government before you go back home. And this is the last project, the Give Back for Life project. This project, we collaborate with TECC and CMU because we contact with many camps, so we can find a suitable donor to be the donor of the blood. So the blood transfusion may take place in the anemia case or herpesvirus case in baby, as we use the plasma to do the plasma transfusion. So another mission above on the healthcare, we still join the governmental meeting to ask for help for the elephant and mahout. And we have a special thanks for Elephant Healthcare Emergency Lifeline because they also support a lot of our team, both veterinarian and to the vet nurse. And also sponsor for us to travel to the eastern part of Thailand so that we can donate the equipment for do the cast for the broken elephant leg. And also our vet nurse from every camp of us. And thank you for all the donors that sponsor for us to help elephant all over country. And now we still have to help elephant with the 1.3 million baht. So we want to share that we don't help elephant just only one organization. So this is some of the other organization. Like TAT, they also open the campaign for the elephant owner and elephant camp to register to take some of the budget for 1 month to help them to take care of elephant. And Thai Elephant Research and Conservation Fund, they also travel all over to deliver the pellet food from CP, and they also send the disaster relief bag package to the Mahout and the Mahout family. And this is a Facebook page named Ijan. They also help the elephant that go back to Surin. Surin province right now they have about 220 elephants that go back home. So right now in Surin there are a lot of elephant population there. And this isร่วมกตัญญู Foundation also help on elephant food and elephant mahout too. So we will still help the Thai elephant, and if you like to support us, please check us out on our Facebook page. And many of you may asking how long that we have to do this project, and we still don't have that answer because the COVID crisis is not finished. So even the Thai government try to promote the Thai people and expats in our country to visit the elephant camp. They also launched the CHA standard with the standard that ensure the tourists that it's safe to take the trip with the camp that have CHA standards. And we still consider that the income will not be enough to take care of the all elephant as we used to do, because before this crisis we have a lot of international tourists visit us and a lot of income to take care of elephant. But right now we have to change many management so that we can survive during this crisis. And the near future, we will be facing on the cold weather and long drought period again. And we will have to make sure our elephants are healthy and ready for that. Hopefully that the air pollution or PM 2.5 will not be returning soon, as it will also reduce the amount of tourists that visit our elephant. So thank you to all the supporters, and thank you to all of you to listen to our mission today.
Dr. Thip, just thank you very, very, very much. I think you have been the busiest team, the busiest people in Thailand since March struck. Anybody who spoke to me at the end of March, I was openly saying some of the things you guys pulled off would be impossible. You've proven me wrong. Fantastic work. I'm just in awe of what you guys, and I know it wasn't just you, but you had a very, very large part in it. I am in awe of what you guys have achieved. And as you say, unfortunately, it's not the end of it. We have to keep going. I hope you guys have the energy. I'm proud we've been able to give a little bit of support as well. And before we went to the questions, I just wanted to give a personal thank you for all of that work, because I mean, I've seen it in action, I've heard about it, but when you all put it all in one place like that, it is awesome what you guys have done. So thank you very much from me and to you and the team and from everybody in Thailand. And now we'll go to the questions, which I don't know who's going to read them for you or whether you'll read them directly. But again, thank you very much. I mean, fantastic work. Some of it I would have said was impossible. I did say was impossible, and you've done it. So from us, fantastic. Now onto the question before I get too emotional.
So I guess me and U will try to read out the questions that we have. So the first question that I actually picked up was actually from U. Do you want to rephrase the question?
Of course, yes. So just a little bit long story. Like last month, I went back home to Nakhon Si Thammarat, as you mentioned, is a part of the project. And I met some elephants that used to work in Phuket. And now, as everybody know, no tourists, no income. So they decided to move from Phuket to Nakhon Si Thammarat. And they just live near the temple, rent a small land, and sell food for the tourists to feed the elephant. the question is like, if they need help, how can they contact you guys, or is there another places at the south would do the same like you, or would accept like, you know, provide space or some other thing for the elephants there?
Yeah. So for southern part, especially for the Nakhon Si Thammarat, they can contact to STEP, the Southern Thailand Elephant Foundation, because they also have the, right now they already have the elephant clinic in case that the elephant gets sick, or if they need some of the medication, they can contact to STEP or our pet Facebook page for help. But right now, just only for the sick elephant and about the health care, but not for the food anymore.
Yeah, the TEAA has closed down its phase 1 on the food, basically. So
Yeah.
now most of the work that is actually focusing on the health of the elephant and making sure that the sick elephant get the treatment that they needed. So unfortunately, Dr. Tip might not be able to send out the fund as they had done in the first phase as well. So some questions that I have is from Dawn. You know Dawn, right? So Dawn asks is how many elephants can you treat per day if you have a full day to yourself?
Actually, we can do like the first aid, like if I cannot, or even other vet like Dr. Bomb or Dr. Wham cannot visit the case, we still have our vet nurse connection. So we can ask some of them to visit the elephant before us, and then can like do in some injection or some giving some pills to relieve, like the pain relief something. And if it's not good, like in 6 or 8 hours, we can refer to hospital. But mostly, like the most that we can take care, I think like 5 cases per vet. If by myself have to work on elephant, like suitable should be like not more than 5 cases per day for one vet.
Yeah. Well, hopefully we don't have to travel to all the 5 different elephants as well. So it's actually best if we can actually get them into one spot per se, so that we can also focuses on and monitor all the elephant that is in the vicinity as well. So another question from Pitosh. So Pitosh asks, when do you know that you want to be an elephant vet, and is it like during college time, or is it since you were young, or when is it?
Actually, when I started in the university, they also have like some of the case in TECC hospital, and I visit there a lot and help on the research. So I like the elephant since like in the university, but it actually have a opportunity to work just only 8 years ago and until now.
Yeah, well, I think everybody starts somewhere, definitely. Yeah. So there's actually a little bit more, let's see, a serious question that also we have as well, is whether, so it's from Jody, so one part of our fans from the TTAF page. So she asked what do you think about the general attitude of the Thai people toward the elephants themselves? What do they think about the elephants? Like how, I guess, I don't know.
Okay, so just for Thai elephant, I think most of them love elephant, but it's quite different, because some of them might even know about elephant more. Like people want to donate to us a lot to help elephant. It's like they love elephant. They want to have a good take care. But Thai people doesn't know about Thai elephant management, or the traditional way to treat to take care of elephant. as well as the foreigner tourists. So we still have to do the public, the general public about that, like why we have to use the chain, why we have to use the hook. They still have to more and more on learning, both the foreigner and both for Thai people. But most of them love the elephant because we believe that it's like the big animal and it have a long history with Thai in many ways, like in the religion, in the elephant the Thailand history, like they are the elephant war before, something like that.
Yeah, so definitely it's very unfortunate that for Thai people basically is that part of the thing is we take elephants for granted because it's always seems like we have, when we grow up, I think we actually see elephants in elephant camp before, and we always know that, you know, Thailand have elephants, and we don't really sit down and I guess learn about the elephants themselves. So it irks us a little bit, like, oh, Thai people doesn't really know about the elephants, but you know, but however, when it comes to things like if we want to ask for helps, and we do have a lot of like donors and sponsors out there that are actually willing to also, you know, help the elephants whenever they can. So that's how the TAA also had funded a lot of it phase 1 and also currently in phase 2 as well. So there is the next question is there specific sites you can put in the chat to donate directly to the mobile vet unit? Do you want to talk about that, Dr. Tip? I know the answer too.
คือยังไงบ้างนะแหวนขอภาษาไทย
ค่ะ so ก็คือมีคนถามว่าถ้าเกิดว่าอยากจะแบบเหมือนสปอนเซอร์แค่แบบว่าเป็นแบบเป็นโมบายเวทยูนิตของสัตวแพทย์เนี่ยคือจะทำยังไงได้บ้าง
โอเคค่ะ so actually you can donate and talk with our staff that you want to donate just only for the car or maybe for the truck that deliver the elephant, and we can like do the report for you. Yeah, how about what about the budget, and what is the case that we use your budget for that.
And so, if you guys are actually
so let me just jump it. So okay. So I think we can put the link to the Thai Elephant Alliance for people in Thailand, and that's donating. I don't have the link on me, but I'm sure we can find it, and we'll put that in the chat, and we will put that on the YouTube as well. And unless Dr. Tip disagrees, I think that's great for people in Thailand or who are able to do international transfers. Also the Elephant Healthcare and Welfare Lifeline Fund for those of you in the States, and we can put a link up to that, and that will also go and help the vets who are doing everything. So we can put both links up, and we will go from there. Sorry, back to Nisa.
Yep. Sorry, it's me as well. So I think maybe you can tell the name of your organization again, because like they want to know what is the specific name of, you know, the place that they can contact to ask for, to help.
Yeah, the name is Thai Elephant Alliance Association. So you can call TEAA for the short name.
For now, can you just flick back through your slides? I know it's a long way because I think you had the contact up there as well, so people can read that while we're talking.
Okay.
Any question from Facebook, Ka Kun U? Like, I'm looking at the chat at the moment.
So since you talk about EEHV, right? So and blood donation as well. This is about blood donation from Rebecca. Do elephants have multiple blood types like human? Can you type in the field?
Right now, they still don't have the research about the blood group, but before we do the blood transfusion or the plasma, we check for the compatible, like the major and minor, so that we can avoid the anaphylactic shock later or allergy to the blood. We still want somebody to learning about that. If you have some of the project or the research, you can also doing about the blood type. Yeah.
because we also want to know whether there is elephant blood type or not. So
Yeah.
it would be nice actually. Yeah.
Okay, and I've just put the TEA link into the Facebook chat as well for those who would like to follow it.
Yep. So anything else, Ka?
Okay,
Okay.
so question
Carry on.
from Tony, like, do you work for TECC in Lampang?
No, we don't work for TECC, but we help them on many cases that in case that they need more of the vet team, we willing to go.
Well, the TEA also actually had referred numbers of elephant cases all over Thailand, actually, to the TACC, and there are actually some of the cases that are still at the elephant hospital at the moment as well. So Dr. Tip, I've actually seen Dr. Tip traveling back and forth between Lampang and Chiang Mai to actually treat some of the elephant that are there as well. And if I'm free, I'm also will go.
Yes, it's a massive collaboration. The whole thing has been a massive collaborational operation between the government entities, including TECC, Chiang Mai University, Kasetsat, and others, and then the Thai Elephant Alliance, which represent, I guess, more the private sector. So it's, again, I'm in awe of the way everybody has worked together to make this happen.
Yep. So
Yeah, I don't see any other questions from Facebook, so I guess that's it.
Okay.
So if we still have time, so maybe can I like open some of the clip?
Oh, can I have
Oh, yeah.
last question before you go for the clip? Question
Yes.
from Jody: what motivates you to do this work?
If for the elephant work, it's like I love elephant and I like to I love to see them in the good condition. So when we do the treatment or we success on the recovery or something, it will be like very good to see that they still be with the human, they live with the mahout, and they are also very unique animal because they're similar to, I think they're similar to us because they are variety of their personality. If you see them every day, you got to know them, that it's like your family. You have some like the experience with them, so they also treat us like we are family too. Yeah, so it's like some kind of special bonding, I think, when we doing the work with them. So quite very special than the other species.
Yeah. Okay. You can start if you want, you can actually share the video clip as well, so that the TA had actually made the clip for their 150 days of missions from March.
Mm-hmm.
ใช่ไหมคะ?
Yes.
Yep.
So you can see in the clip that how is the draft situation during that first few months of our project.
Oh, you have to remember to share to share the screen.
I've got it.
Oh, you've got it. Okay.
Oh, okay.
ที่เลี้ยงช้างเนี่ยจะไม่เทียบกับธุรกิจอื่นแล้วว่าเราอาจจะไม่สามารถทานความยากลำบากนี้ได้นานเท่าเขานะครับที่ไม่สู้มันก็ไม่ได้ที่นี้อยู่กับช้างนานช้างเนี่ยเมื่อลูกในอนาคตอีก1 เดือน 2 เดือนข้างหน้าผลกระทบจะเป็นอย่างไรเป็นหนักหนาเพียงใดน่าจะเยอะกว่าเดิมมากครับ
Okay.
Great. Well, thank you very much, Dr. Tip. Again, I've said thank you enough times as well, but I can't say thank you enough times, I should say. It's amazing work. And well, you know, we're here to help support, and we'll continue to help support as best we can. As you say, the PM 2.5 and the dry season coming up.
Yeah.
The work isn't over yet, but as I have said, and I will say, continue to say, you've done an amazing work so far. And we're together, we have no choice. We have to get through this. The elephants are there, the mahouts are there, and I wish I could had the energy to work as hard as you have. But thank you again for what you've done. So as far as that goes, all that remains for me to do is wrap up. They say to say thank you to our sponsors here, Anantara Golden Triangle. If you are in Thailand, you can come up and have a coffee with us, and you can have a look at our elephants down below. And as I say, Thai Elephant Alliance, if you want to support financially, Thai Elephant Alliance are the people to go to within Thailand. And if you can't do an international transfer but are in the States, we will post a link to the Elephant Healthcare and Welfare Lifeline Fund, which is in the States, and all of that money goes to support the vets and support Dr. Tip and her team to keep these things going on. So we will do that. Next week, our elephant professional lecture, we go a bit global. We leave Thailand. We go to newly minted PhD and second most Googled hunter this week, Hunter Doherty, who will be talking about her work to influence the wildlife trade consumers using strategic online techniques. So a bit of a change in pace, but similar level of conservation, and some of the innovative things she's done to try and, or she's done to try and persuade people not to consume illegal wildlife parts, including, well, ivory you don't consume, you don't buy anyway. So it's a new approach she's come up with, and she will be telling us all about that, a very new paper. So that's next Wednesday at 5 p.m. And that's all we have. And I mean, I'm going to say it again. Thank you very much, Dr. Tip. If you have any last words, please do use them. If not, we will leave it at that, and we will see everybody later.